All right, we're going to start with our 12 safety practices. We're going to first verify any care or orders for the client. The next thing we're going to do is wash our hands before and after any patient care and when handling any supplies. Next, we are going to review any policies and procedures at the facility, and we will gather and assemble appropriate supplies. After this, we will review recommendations from the manufacturer regarding the use of their supplies. We will then knock on the patient's door, enter and introduce ourselves. We will then identify the patient using 2 patient identifiers, such as name and date of birth. After this, we're going to note the overall condition of the patient. We will then explain the procedure to the patient and provide the patient with privacy. We're then going to elevate the bed to a level for good body mechanics, and we're going to don any PPE that is indicated. Following the skill, we're going to remember to place the bed into lowest position, apply side rails as indicated, and we will place the call light in reach. We will also report any abnormal findings to the nurse or the charge nurse. All right, good morning, Mr. Hawker. My name's Dylan. I'm going to be your student nurse today. I came in here today in order to do your physical assessment part 1. Is it okay if we get started?
Yes, sir.
All right, I would like to note that the height, weight, and vital signs were previously recorded. All right, Mr. Hawker's in pretty good condition. His development is appropriate for his age and gender. He's very well developed and well nourished. He has no striking features. He's not exhibiting any symptoms of distress or discomfort or pain. His behavior is appropriate. He's acting very appropriately. He's not combative, and he's very compliant to the current situation. He has good posture. He's sitting in an upright position. His shoulders and his hips are in parallel alignment, and his head is erect, his body's erect, and he's not slumped over. I would also like to note that he has good hygiene. He's very well groomed. His hair, skin, and nails are all clean, and I'm not noting any foul odors from the patient. His communication is good. He speaks very clearly, and he responds appropriately to all my questions and commands. All right, Mr. Hawker, I'm going to go ahead and assess your skin this morning, okay?
Okay.
All right, Mr. Hawker's skin is tan in color. I'm not noting any pallor, jaundice, or cyanosis. His skin is uniform over the entire body. I'm going to go ahead and check the temperature of your extremities, if that's okay.
Of course.
All right, his upper extremities are warm. Your lower extremities, those are warm as well. All right, his skin is very smooth and it's dry. It's whole, intact, and it's undamaged. I'm not noting any lesions across his body anywhere. I'm going to go ahead and check your mucous membranes. What I'm going to have you do is pull your bottom lids down. Okay, and I'm going to have you open your mouth. I'm going to take a peek in your nose. All right, all of Mr. Hawker's mucous membranes are intact. They're pink and they're moist. I'm not noting any lesions or bleeding. All right, Mr. Hawker, I'm going to go ahead and assess your hair if that's okay.
Okay.
All right, Mr. Hawker's hair is brown. It's thick and it's coarse. His hair is also very evenly distributed across the entire body, and I'm not noting any alopecia. I also did not note the presence of any parasites in his hair. All right, next we're going to take a look at those nails. All right, let's see here. His nails are pink and transparent. They're very smooth and thin. They are rounded, and they have a good 160-degree nail bed angle. All right, your nails look good. All right, the next thing we're going to do is your musculoskeletal assessment, okay? What I'm going to have you do is, I'm going to have you do some range of motion. Is that okay?
Of course.
All right, we're going to take our elbows and we're going to bend them like this. All right, very good. I'm going to palpate those joints while you do it. Go ahead. Any pain?
No, sir.
All right, he has full range of motion in that joint. He's not exhibiting any pain. He also did not have any edema, kerpitis, or heat. All right, I'm going to have you do your knees. We're going to bend those.
Okay.
All right, I'm going to feel. Are we having any pain with that?
No, sir.
All right, he has full range of motion. There's no pain present, no heat, edema, or crepitus noted. All right, the next thing that we are going to do is I'm going to check your tone, okay?
Alright.
What I'm going to have you do is press against my hands. Press, press, press. Alright, good. And we're going to pull. Alright, I'm going to give his tone in upper extremities a 5. We're going to do the lower. Press against my hands. Alright, and pull. Those lower extremities have a tone score of 5 as well. I would also like to note that upon his entrance into the exam room, his gait was normal. It was a very natural gait. His hands were swinging freely by his sides, his body was erect, and he was leading with the head. I would also like to note that his posture when he came in was very good. He was standing in an upright position, his head was erect, his shoulders and hips were in parallel alignment. All right, Mr. Hawker, the next thing that we're going to do is your neurological assessment. Is that okay?
Of course.
All right, we're going to assess for Perla. I'm just going to look at your eyes, okay?
Alright.
All right. His eyes look good. His pupils are equal and they're round and they're at about 4 millimeters in diameter. I'm going to have you look off at that wall and I'm going to shine some light in your eye from the side, okay?
Alright.
Just seeing if they react to light. That pupil constricted. And then this pupil also constricted, so we are reactive to light. All right, the next thing that we're going to do is check for accommodation. I'm going to have you look over at that picture on the fridge. I'm going to place this about here. Now look at my pen light. Now look at the picture. Back at the pen light. And back at the picture. And his pupils did accommodate well. All right, last, I'm going to have you, I'm going to test your balance, okay?
Okay.
All right, let's stand up. I'm going to have you put your hands at your side.
Okay.
We're going to close our eyes. And I'm going to have you stand on your left foot for 5 seconds. You can go. 1, 2, 3, 4, 5. Good. Other foot. 1, 2, 3, 4, 5. Good. All right, you can go ahead and have a seat.
All right.
There was minimal swaying and his balance was very good. All right, I'm going to go ahead and we're over here. I'm going to grab my essential skills in review. Make sure we hit everything. Alright, I believe that the only thing that I have forgotten to do was during skin assessment, I forgot to check the skin turgor. So what we're going to do is we're going to pinch the skin here. Alright, and it immediately went back. There was a less than 3-second return and there was no signs or symptoms of tinting. There was no tinting present. Alrighty, I believe that's all I forgot.